What's the basic skincare routine? Does your diet impact your skin?
Skin is the largest organ. I'm going to say that again and again. Sugar, stress, and sun. These are three things that directly impact aging. Aging is about how my body repairs. We should retain the innocence of our skin as much as we can. I don't really advocate a lot of makeup, and young girls should not use a lot of makeup.
What is good makeup? How do I know what is my skin type?
Our skin is taking so much wear and tear from the outside world, the environmental factors, and our own lifestyle. Dermatology has now progressed that we can help anyone of any age now.
Is how much do these things cost?
The longer that you retain the innocence of your skin, the longer it will be on your side later.
So skincare is an extremely important element of people's lives today. People want to look good. How do you look good? Not just on your wedding or when you're going to somebody's wedding or a party, but people just want to look good, and you can't blame them. So today we are lucky because we have a skincare expert. We have a dermatologist, an MBBS, MD from top colleges of India with a lot of experience, Dr. Niti Gaur. Thank you, Dr. Gaur. So my first question really is the very basic question. What's the basic skincare routine in the day, in the night? How do people make their skin better just by their routine? What things should change in the routine?
So skin is the largest organ of our body, and like every organ in our body, skin also has a circadian rhythm. So when we decide what should we do ideally for a good skin, it is how and what we should do for any organ of our body, which is during the night time, it is in a rest mode, it is in a repair mode, and during the day, it's in a defense mode. And all our organs are in that mode. So accordingly, the products that we use at night or a night time skincare routine should be more in terms of repair, more in terms of resting the skin, more in terms of pampering the skin. And during the day, we should assist with products that protect the skin and they act for your skin's defense. For example, you use your sunscreen, you use your vitamin C during the day, and at bedtime you would use your peptides, your retinols, your hydrating creams, your hyaluronic acid, all of that at night time. So an ideal skincare regimen should be hydration and repair at night, and protection, sun protection, photo protection, and anything that will add to any of these protective benefits during the day.
So what is hydration of the skin?
When we talk about a moisturizer, we're looking at, or hydration, we're looking at sealing the skin, and we're looking at keeping it soft, supple, hydrated, because that's like a skin barrier. You have a lot of natural lipids in your skin which actually hydrate and protect your skin from external agents. And also it helps us seal the transepidermal water, which is the water content of your skin. So keeping both of these intact, that is the skin barrier and the transepidermal water, is like you're protecting your skin, because your skin is the first barrier of immunity. So if your skin is hydrated, you have a layer of protection or layer of immunity which is intact.
So when you say there is water inside the skin, what does that mean?
So there are these elements, which is hyaluronic acid, which absorbs water. It retains the moisture, the water inside the skin, which helps to, water is in every organ of our body. Skin is also one organ. So when your skin has a lot of water, which is in right quantity, it has everything in defense which is intact, and it is able to protect and provide immunity that it is supposed to as the first barrier of contact. So if you have a lot of dryness on your skin, if your skin is not hydrated, your skin is more vulnerable to all the external environmental changes that the skin and the body has to go through.
Got it.
But if it is hydrated, if it is sealed, if the water content is high, the lipid content is right, the lipid layer is intact, then your skin is protected from the external factors, all your environmental factors.
Now, the next question I have is about what do you eat? Does your diet impact your skin?
Skin is the largest organ. I'm going to say that again and again.
Sure.
Like what we eat impacts every organ of our body, it's going to impact our skin.
Okay.
So more or less, if, and this being the largest organ of our body, and it has the slowest cell turnover rate. So whatever that you actually eat, frankly, is going to all the other essential organs of your body, and in the end, it's coming to your skin. So I might think I'm eating the most healthy food and my skin should glow, but am I eating in the right quantity, and am I eating the right thing? Because it's only after all my essential organs have been supplied with the right nutritional elements is my skin going to get that in the end.
Got it. Okay.
But broadly speaking, I should be on sort of a diet which is low, or sort of I should have my carbohydrates in moderation. I should not have like a lot of carbohydrate consumption in my diet. So I should reduce my chawal, aloo, kela, meetha. Lots of vitamin C, because vitamin C is a natural antioxidant. It's a photoprotective agent. It's a lightening agent. And it also helps to repair your skin and all the cells in your body. It's an antioxidant. So a lot of vitamin C in your diet, a lot of magnesium in your diet. So nuts, seeds, dark chocolate, all of this which is rich in green leafy vegetables, all of this which is rich in magnesium also, because with women especially, and see, skin is a reflector of internal body status. So all our hormonal changes, all the stress that we go through, skin is going to reflect that. So with women especially, with all the hormonal dysregulation, acne, pigmentation and all of those issues, magnesium-rich diet is going to be, it's like a path that you're taking in terms of your diet to control your hormones, to sort of help with your sleep, to help in skin hydration, control of the activity of your oil glands. So a lot of things can be just taken care with the right diet. And of course water. Because the more water that I drink, the higher will be the transepidermal water content of my skin. The more hydrated my skin is, the more stronger and more active in terms of its defense it will be.
So can you give some examples of these things? You said high vitamin C, high magnesium. What are the things which are high vitamin C,
so
high magnesium?
Vitamin C would be nimbu, avla, tomato, oranges, kiwi.
Okay.
And magnesium would be all your nuts, all your seeds, dark chocolate, green leafy vegetables. All of this is very rich in magnesium.
So they are all good for your skin.
Yes, absolutely.
And have less of carbs.
And have your carbs, because you want to balance all the metabolism in your skin. You don't want excess of anything, and you don't want to completely deprive your body of anything. So have your carbs, but have them in moderation. So your chawal, aloo, kela, meeta, you have it in moderate quantity.
What about sugar?
Sugar is carbohydrate. And sugar, frankly, to delay aging, the amount of sugar, stress and sun. These are three things that directly impact aging.
Sugar, stress and sun. Yeah. Okay.
Now, so if you have a lot of sugar, you're invariably going to age faster.
Oh.
So that's why carbohydrates. And that is why diabetes or anything to do with carbohydrate metabolism slows down the repair mechanism of our body. Now, what is aging? Aging is not chronological age. Aging is, I could be 50 or I could be 60, but I could be fitter than a 30-year-old.
Sure.
No? Aging is about how my body repairs. It's my repair mechanism, and skin being the visible organ is going to reflect if my repair mechanisms are not in place. I will have signs of aging, I will have photo damage, I will have pigmentation issues, I will have dullness, I will have variation in my skin texture, I will have early sagging coming in. All of this will happen if the factors of repair are compromised. And sugar, stress, and sun exposure. These three things directly impact the process of repair, and hence they contribute to early aging signs.
Every doctor I meet, I ask them one question, that I gave up sugar on 1st January 2024. And I've been off sugar since then. I'm feeling very good about it. Everything is going well. My family feels very worried because sugar you've given up, and are you sure this will not damage you in some way? So you are saying it's a good thing?
Yes, absolutely. And there are lots of other sources of carbohydrate that we anyways are taking. Sometimes we're taking them as a choice. Sometimes in so many other things there is carbohydrate that you don't realize. Your body is getting compensated for it.
So giving up sugar will not just help me control aging, but also otherwise is a good thing for me to do.
Absolutely.
Now let's come to what people are doing for their skin, right? Which is external, which is putting makeup, and people want to look good, and I can't fault them for it. Everyone wants to look good. But putting makeup, a lot of makeup, putting it very early in life. When we were young, girls used to start putting makeup at 18, 19, or even in 20s. Now it started happening much earlier. Early teens, 12, 13, 14-year-old girls start putting makeup. How do you see all that? Is that okay? Is that not okay?
So, I'm of the opinion that we should retain the innocence of our skin as much as we can. Mm-hmm. Because that's going to go a long way. Mm-hmm. And that is why when a lot of young girls come to me, whether it is makeup or whether it's a lot of products that you probably would see on social media, and you would be suggested for glow or skin lightening or whatever, I'm of the opinion that we should retain the innocence of our skin as much as we can. So a lot of times when girls use a lot of makeup, they may not be using the right products that are required for their skin. So they have a lot of irritant contact dermatitis, a lot of irritation on the skin. Their skin barriers are so often impaired. They have acne. Sometimes they also have pigmentation issues. That's called Reals melanosis. That is because of the products that we have used. So my opinion, and I'm very vocal about this, that I don't really advocate a lot of makeup in, young girls should not use a lot of makeup or use a lot of products. When you're young, let's say till you're about your mid-20s, just using a moisturizer at bedtime and a sunscreen during the day and washing your face twice a day, that's all.
Oh.
That's all. You really don't need anything more than that. Yes, after 25, because your skin is taking so much wear and tear, and there are so many other changes in your body, with all the stress factors, with all the wear and tear the body has to take from outside, so many things can probably be affecting your skin also. So in that case, yes, after 2025, you can consider using products which help in skin cell rejuvenation, hydration, skin lightening, depending on the indication that is required, but not unnecessarily.
Is there a disadvantage? Is there a harm when a 13, 14, 15-year-old girl is putting a lot of makeup? Does it damage in some way?
Two ways. One, I probably could be using products which are occluding my skin. When you use makeup, you ideally have to hydrate your skin, use a thick layer of moisturizer, then put your foundation. So for a young girl whose skin is just getting formed, it's not completely formed yet, and the glands are just opening up, the oil glands. While all of those changes are happening, we're probably occluding the glands. So you're exposing your skin to the possibility of acne, teenage acne, which is otherwise a regular change, but a little more inflammatory acne, which could then scar your skin also. When we're dealing with young children, it's the confidence that should reflect on your skin and in yourself. You really should not be dependent on makeup or any other product at that age. Yes, there will be a time when you will need it because it can enhance our look, it can enhance our features, but there will be a time when you can start using that. Let your skin speak, let your skin be healthy, let it speak. Anything, see, we associate this organ with beauty. Skin with beauty, but it's just the largest organ of our body, and if it is healthy, it will look beautiful. So let your skin be healthy and it will look beautiful, and enjoy that beauty.
So instead of putting that much makeup when you're young, eat right.
Eat right, do the right things for your skin, sleep well, sleep on time. It's the lifestyle factors that will reflect on your skin more than anything
else. Sleep also will have an impact?
Of course, the circadian rhythm. Like it is going to affect every organ of our body, this organ is also one organ of our body, and it will affect it.
So I guess the sad part is that youngsters today are doing almost the reverse in every way.
Yes.
They're not sleeping at the right time.
And that's the whole problem that we're seeing in the, I think it's the lifestyle factors, which did start about a decade or two back, in terms of what we were eating and the way we started working so hard and at odd hours and all of that. So not eating on time, not sleeping on time, these basic things can also affect our metabolism, and hence they will affect our skin also.
Right.
So that's why we see a lot of hormonal dysregulation. You see a lot of acne beyond the age of 20-25. You see a lot of young girls, young boys with pigmentation issues. You see early male pattern baldness coming in men, female pattern hair loss coming in girls. So all of this is a reflection of lifestyle disorders that we're getting exposed.
So the other thing I'm capturing that you said is that till 25, use a moisturizer in the night. So you think that is useful?
Yes.
And a sunscreen in the day.
Absolutely.
And that's about it. Now what about after 25? When you're saying it's okay to now start putting on makeup, what is good makeup?
Good makeup is your skin type based product. If your skin is oily, then you use a gel based product. You use products which are very light and non-comedogenic. But if your skin is dry, then you use cream-based products, which are hydrating on your skin, which even if they form a thick occlusive layer, will not harm your skin. So use products which are for your skin type and not what your friend or your sister or somebody else that you know is using.
The other thing I've heard from a lot of friends and cousins and nieces is imported is good. Right? And that's also partly Indian mindset that anything which says imported is good. What do you think? Does India have good products, or should people look at imported products?
No, we're making decently good products now. Frankly, the last decade or so in India, as far as skin care products are concerned, there has been a lot of progress, lot of research, lot of development, and we're using very good products now. So this whole mindset about imported product or an Indian product or all of that, I don't think stands true now.
Okay.
I think we're doing decently well with products now.
But imported is also okay if people are buying things
your
from
skin type,
US or UK or China or
it's
Korea,
not the
they're
brand,
also fine.
it's your skin type.
Okay, okay. And how do I know what is my skin type?
You let your dermatologist assess that for you. So like you get your blood test done regularly, you should also get a regular skin consult done, maybe once in a 6 months duration, but you should get a skin consult done.
Wow, wow. See, apart from the fact that I have a sister who's a dermatologist, I have never gone to a dermatologist. And I'm assuming that's what a lot of people do, right?
Yeah, but it's getting better now. The awareness is getting better. And I, being from that generation where we just associated skin with just beauty, to now reaching that level where this is the organ that reflects my fitness. This reflects my health status. This reflects my, so taking care of I believe that taking care of yourself is a sign of self-respect.
Of course.
And skin is going to show how much you take care of yourself. And that mindset is changing now. There is a lot of awareness that we see in people now, the last 5 years, 10 years. And people are genuinely wanting to take care of their skin now.
Are there any recommendations? Would you say this brand is good, this brand is not good, be careful of this?
Not particularly.
No.
Not particularly, because I've seen a lot of times, I may be using a particular brand and it may not suit my sister, it may not suit my mother, and this being me being a dermatologist. So I never opine on a brand on that basis. It's completely what my skin needs. It's the ingredients. It's something that would suit me, that is right for me. It's not the brand. I've seen some of the most uncommon brands working so well for people, and some of the most popular brands just causing such strong irritant contact dermatitis. And would you blame either? No, not really. It's the skin type.
So moving beyond just what you put on your skin, coming to medication, right? There is a lot of medication out there that people take. What's your opinion about medication for it? Allopathic, Ayurvedic, homeopathic, or allopathic because that's your area of expertise. Should people take it, not take it? At what level should you take it? Because skin also historically, people haven't cared too much about, especially men, right? It's almost looked down upon that you're trying to look good and why are you getting fussed about it? So should people really go to the level of taking medication for it, and at what level?
Yes, medication in terms of your vitamins, the B complex range, your vitamin C and antioxidants. And now there is this new trend of taking collagen also for anti-aging. So it's not something that is exceptional in terms of, you cannot just rely on collagen for your anti-aging. I'm having collagen, that's going to be enough for anti-aging. But it is good to assist your body with taking collagen, taking antioxidants, taking your vitamins, the water-soluble vitamins. I'm not talking about vitamin A, D, E, K, which are fat-soluble. But your water-soluble vitamins, your B complex and your vitamin C range, if your body doesn't need it, it comes out in urine. But then your fat-soluble vitamins, you should consult your doctor and they could probably decide the dose and they could regulate it for you and you could take it in those regards. But otherwise, your B complex, your vitamin C, your antioxidants and collagen, this you can take.
It's become, even I go and do a blood test once a year. And when I go to the lab, they say, what test? And I say, do all of them, whatever you want to check. But I never do a skin test. So what I'm learning from you is maybe it's good to go to a dermatologist once a year.
Absolutely.
Right.
See, a lot of things your skin will just tell you. Like, for example, if you have pigmentation along your body folds, it could be a sign of early diabetes. Okay. Or an impending diabetes status, or an impending thyroid dysregulation status. A lot of times when you have patterned acne coming in, which we just tend to just overlook, especially in the Indian setup sometimes, parents say, koi baat nahi, age related hai, don't bother about it, theek ho jayega. But persist kar raha hai, especially along the jawline. It could be indication for a impending hormonal dysregulation. May not be an impending disorder yet, but a dysregulation. So let your dermatologist see, assess, and if it's all right, they'll just tell you it's all in place. Why worry?
So going to a dermatologist is a good idea.
Absolutely.
Once a year?
Once a year.
Is a good option.
I would suggest once in 6 months because that's what we assume every human body changes every 6 months. But if to start with, maybe once a year and then maybe once in 6 months.
So in terms of what medicines to have, let the dermatologist decide.
Absolutely.
In terms of what lotions and creams to use, would that also come from the dermatologist?
Ideally, yes.
Okay.
Because, something like a moisturizer also, there are so many variations in the ingredients of your moisturizer. that if your dermatologist can assess your skin and let you know which is the right moisturizer that you need to use. Maybe I have a very oily skin and maybe I just need a gel-based moisturizer. Maybe I have a very dry skin and I need a thick occlusive ceramide-based moisturizer. So if my dermatologist sees my skin and assesses and tells me, the possibility of it going wrong is very less then.
So again, moving forward from there, the kind of things that people are doing now for their skin is becoming more and more interesting and unique, and new age things are coming in. So I have a friend who has launched a set of clinics in Australia which are doing the perhaps cosmetic work for skin, right? It's called Sculpt, and they are doing things like Botox, and I don't really know, I'm not an expert in that area, though I plan to go and see what they're doing, but it's doing well and it's growing, and I keep talking to him about what they're doing. Is that good? Is that safe? What's your opinion about all that?
So frankly, all the procedures that we now do, whether it's Botox, whether it's fillers, whether it's threads, skin boosters, all of these are US FDA approved. And they're all, not only in India or anywhere now, internationally. The products that we're using or the procedures that we're doing, the techniques that we're doing, they have all been extensively studied, and it's only after US FDA approval are we now authorized to do any of these procedures. So as far as safety is concerned, they're completely safe.
Okay.
But they're injectables. So
Sure.
you need to get them done from a trained dermatologist or a trained plastic surgeon who knows the facial anatomy. Because it's not the product, it's not the procedure itself that is a problem. But if you have somebody who's not a trained physician or who's doing it just as a, as an amateur, as an early person getting into this, then the possibility of it going wrong is a little high. But if it's somebody trained who's an expert, then who knows the facial anatomy well, then there's absolutely no problem.
Right.
They're very result driven, very result oriented, very safe procedures. You feel nice getting those procedures done, why not? When you have safe options now, why not?
And what can they do?
So Botox is it's a neurotoxin, essentially. What it does is it works for your wrinkles. It relaxes your wrinkles. So the wrinkles that come on expression, like when I'm raising my eyebrows, the wrinkles that come in, Botox will relax those. What fillers do is, as I'm aging, there's going to be volume loss, I'm going to have prominence of my nasolabial folds. Filler will support this, will fill the volume loss that is coming in. Threads are going to lift my skin without filling it. Skin boosters are also injectables, but it's very light hyaluronic acid that is injected in the skin. In a way, you're injecting natural moisturizer in your skin. Because you're injecting the right product at the right level, it's going to absorb water and it's going to increase your skin's water content. So your skin is going to be better hydrated naturally. So you're assisting, see our skin, now the times that we're living in, our skin is taking so much wear and tear from the outside world, the environmental factors and our own lifestyle. So our skin is actually going through a lot. So when you have safe options that can assist your skin in the right way, why not? Why not exercise those options?
And these things are available in India also
Yes,
now.
all of these now, all of these.
How does one make sure you're going to the right place?
You have to see the qualification of your doctor, and you must also understand the experience of your doctor. You must study your doctor's profile well before you go. Unfortunately, there are a lot of people, at least in India, we're a relatively younger sort of branch or specialty. So the regulations are still just about being set in place. And there are a lot of people who are not really qualified dermatologists or qualified plastic surgeons who are doing these procedures. So to know the degree of your doctor, you must understand the profile of your doctor and get it done from the right person.
Is this space, like the need for looking good is only growing, rightfully? The need to get cosmetic creams and lotions is growing.
Absolutely.
Is the need for cosmetology or cosmetic dermatology, which is making your face or your skin look better, is this also growing? Is this as an industry growing?
Massively.
Yeah.
Massively. The awareness is increasing. We're doing, more people are getting trained in it. They're taking international trainings, they're executing here. The awareness is increasing. People are traveling. People know about these procedures now. People want to get them done. And the expertise is getting better. Awareness and expertise, both is getting better. And that is why this is, and the need to look good. And why not?
Of course.
Need to realize that I can look good and why must I not look good?
Yeah, it helps your self-confidence,
yes.
it helps in many ways.
Absolutely.
Yeah, why not? Yeah.
So
So you said India is a new entrant in this space.
Relatively, let's say about last 2 decades.
Which means the subcontinent, India, Pakistan, Bangladesh, we're all new in this space. So is it fair to say that the Western world, the tier 1 countries, the developed countries have been into this for longer?
Yes, they've been into this for much longer. The awareness has been there for much longer. Not only the Western countries, the Southeast Asian countries also.
Okay.
So a lot of our trainings actually we do in Southeast Asia or in Europe or in America. But then I think we are very good physicians as Indian doctors. So our grasping is very good. And the execution is also very good. So India is picking this up very fast now.
Okay. Going back to the basics of our skin, what are the problems that a person is going to face or could face in his life? Like the most common one that I hear about, and I don't even know if this is real or we just make it up, is oily skin and dry skin. That's the most common one that I hear. So is that a real problem? And what are the other problems that people could face in their journey?
So oily skin or dry skin is a skin type.
Okay.
It's not a problem. It's a skin type. And if taken care of in the right way, identified early and taken care of in the right way is not a problem then.
Okay.
Like for example, I'll just give you one example in terms of taking care of your dry skin. There's an entity called atopic dermatitis, which is just because there is a protein called filaggrin, which is a little deficient in that skin type, because of which the skin barrier is a little impaired. Because we have something called desmosomes which attach the skin cells. Because of filaggrin being a little deficient in that skin type, the skin has barriers, breaks in the skin barrier. And because of that, the environmental allergens can enter easily through your skin. Now that's a dry skin. You know how your skin, the skin looks like a desert. How you have cracks and breaks in a desert land, that's how your skin is when you have a dry skin. And in atopic dermatitis, it's because the inflammatory process is initiated in the skin because of the allergens, the environmental allergens entering your skin easily. But if identified early as a child, if that skin is identified and you just get the parent to put a regular moisturizer, which is thick ceramide based hydrating agent, you're going to seal your skin. And that's going to be a protection from the external environmental agents. So it's a skin type. We let it become a problem. We let the inflammatory processes start because of not acting early, because of not identifying that this is a skin type that can be taken care of and we can prevent a lot of other issues later.
Right.
So a lot of adult eczema is actually preventable.
Oh.
Because of just, if you start hydrating at a young age with the right products, you're going to prevent a lot of adult eczema.
And when you say hydrating, you've used the word hydrating a few times. Is hydrating largely about drinking enough water? Putting enough moisturizer?
So for us as dermatologists, hydration is about moisturizer.
Okay.
But yes, you should also, this is something that a lot of times people misconstrue the concept of hydration when a dermatologist says the word hydration. So they may tell me, doctor, I drink a lot of water, मैं तो बहुत पानी पीता हूँ. But pani is going to go to all your organs.
Okay.
If my skin type is a little dry, it has the composition in such a way that the molecules that are there in your skin are going to absorb lesser water. So I may be drinking a lot of water, but it may not be reaching my skin because my skin type is like that. So for me, hydration as a dermatologist is your moisturization.
So can a dermatologist just look at me and tell me my skin type largely?
Yes, but now we also have tools. But frankly, an experienced dermatologist, it's a very observation-based branch. And an experienced dermatologist can look at your skin and they can tell you, they can assess and they can let you know what is your skin type. But there are tools, there is Wood's Lamp, there are other skin scanners that we have, which can help assess your skin type and maybe also the damage that could be possibly happening on your skin because of environmental factors. But a dermatologist can also assess and let you know.
Can I find out from you what is my skin type? Is it oily, is it dry, or is there some other type?
So yours is more, it's a combination skin, but more on the dry side.
Okay.
And also, you have a lot of photo damage. So I'm assuming you haven't used a lot of sunscreens through your primary years.
Never.
That's the
I don't use anything.
Because I see a lot of fine lines which are not age-related, which is because of photo damage. So using a sunscreen, you know, if you would use sunscreen then, a lot of this could have been prevented. It's a good skin.
Oh, okay. So I have good skin.
I would say this is a good skin.
Okay, that is one. The second is, you said if I had put sunscreen in my early years, I wouldn't have had fine lines. What do you mean by fine lines?
So when we talk about sunscreens, we're talking about photoprotection.
Okay.
So which is protection from all ultraviolet light sources, which is your sunlight, tube light, laptop, mobile, TV, any of these ultraviolet light sources, they cause photo damage on our skin.
Okay.
So when I see a lot of these fine lines.
Oh, the wrinkles.
So that is because
Are
of
there
photo
wrinkles
damage.
now?
They're wrinkles now.
Okay.
But then in early stage there would have been fine lines,
Okay.
which is the indication of photo damage. So using your sunscreen is going to protect you from a lot of this photo damage.
So what can I do today? Or
You
I can't
need
do
to
it?
no, of course you can.
Time up.
No, of course you can. Now, fortunately, dermatology has now progressed that we can help anyone of any age
Okay.
now.
In terms of people who come to you, is it mostly women or do men also come? Will I be the crazy guy coming to your clinic?
No, now it's not. It's not like that anymore. Probably 10 years back when you and I had discussed this, we would have said it's mostly women. But frankly, now, let's say about earlier, it would be 20% men that would come in for consults for cosmetic concerns and 80% would be women. Now it is about 50% women and 50% men.
Really?
Yes. So the times are really changing and it's a really good time actually to realize that the awareness is so nice now.
So if I come to your clinic, I will see 50% men.
A lot of men, yes.
Waiting to see you.
Yes, yes.
Wow. Wow, that's really interesting.
And they no longer need their wives to push them to come in for a consult. They walk in themselves wanting to understand what can I do for my skin or my hair or, all of that.
And the other question is if for somebody like me or any person at this age and stage of life starts doing these things, how much time will it take for me to see a difference? And will I see a difference?
Yes, you will see a difference. We will need to take the help of some procedures also because just products are not going to take care of everything. There's a lot of things that can be handled with products, some, I won't say damage, but some aging changes that have come in and we want them to look a little better, then we'll have to take the help of some procedures also. Definitely they show results, but the skin cell turnover is such that you don't see gratifying responses in just a month or 2 months.
Sure.
This has to be a discipline.
A year?
6 months to a year, yes.
Okay. And what procedures, when you say procedures?
So for someone like you, I would suggest getting a HIFU done, which is high intensity focused ultrasound, which is a non-invasive energy-based procedure to stimulate fibroblasts to produce collagen. So that will help in skin tightening and making your skin more firm. Post your HIFU, take the help of some fillers to fill in the defect in terms of your nasolabial fold and the volume loss that has come in. To start with these, you start with these and get a little bit of Botox done for your wrinkles. Later, but for somebody else, so somebody who has massive sagging, I would suggest threads, we lift them.
Okay.
We would lift and then we would do fillers.
Okay.
Very safe procedures, very result oriented.
Okay.
And you feel nice. There's a bit of a downtime.
Okay.
Because you may have these injectables, so you may have a little bit of redness, you may have a little bit of swelling for a few days post the procedure, but though that is very transient for a few days, maybe 48, 72 hours, and then you're fine.
I'm quite excited. The other question I have, which is partly for me, partly for the people watching this, is how much do these things cost? If somebody comes to somebody experienced like you, how much would these things cost?
So, the cost is not of the product, frankly. And that is why I am of the opinion that we mustn't bargain with this. Because the cost is of the expertise.
Sure.
Yeah? That is my education. That is my years of experience.
Of course, yeah.
All my trainings that I have undergone, or any other doctor for that matter. What is my side effect profile like? Because obviously that depends on my training and my experience, my hands-on and all of that. And that is why the cost is depending on who you're getting this treated or you're getting this done from. So frankly, it's about being cost effective.
Okay.
Yeah? So if I get it done from the right person and I don't have side effects and I look good, it doesn't matter, how much does that cost?
But that's why I'm saying, the cost of somebody going to somebody who's good, somebody who's experienced like you, approximate range, do these things, like if somebody like me was to come and spend the next 1 year doing these treatments?
So, let's just, let me give you a brief example in terms of Botox and fillers. Botox, we calculate the number of units a person needs. And the cost range is between 300, 400 rupees per unit that you would need. And the unit would be calculated by your doctor depending on the muscle movement and the wrinkles that you see with those muscle movements.
Okay.
And fillers these are pre-filled syringes of 1 ml each.
Okay.
And those are injected depending, and the requirement will depend on the amount of volume loss or the amount of lift that is needed. So there are different fillers for different indications. And typically, experienced doctor would charge anything between 25 to 35,000 per ml for those fillers, and that would depend on how many ml you need.
Okay. Going back to again the basics, when I was young, the common things, the problems that we would hear about are things like acne, dark circles, Are those still
Of course.
big problems?
Yes, of course.
And do these
And
treatments...
that has only increased.
And does dermatology help, or is it something else that helps for those things?
No, it depends on the grade. Like earlier, when we were younger, we would see mostly teenage acne.
Okay.
Now we see acne, we see a lot of adult acne now. That's because that's a reflection of a lot of hormonal dysregulation that we are seeing young girls go through, especially in young girls. We see it in boys also, men also. But that could also be because of other lifestyle factors. For example, a chronic vitamin D deficiency, a chronic B12 deficiency sometimes can also cause acne. A thyroid disorder can cause acne. I would say the number of cases that we see of acne or of pigmentation issues is only increasing. But the treatment will depend on the grade, not the... So it's not that for every case I can probably just give medicines, or for every case I need to do a procedure.
Okay.
It just depends on which grade, what grade, and what are the associated comorbidities that I'm dealing with.
Okay.
Depending on that, would I decide whether this just needs medication, sometimes just oral, sometimes just application, or does this need help and intervention in terms of other procedures also?
Again, when I was young, the most common problems I used to hear from my cousins and friends was about dark circles, acne, and such things. And the most common solution that the mothers used to give is home remedies, remedies. Nimbu and rub things on your skin and those kind of things. So do those still hold value? Are they really useful? Because in those days, I guess people didn't have other options. So people would do these things. So what do you think about those home remedies?
Number one, the home ingredients that we used to have when we were younger, or when our dadis and nanis would suggest them, they were very different. Nimbu then and Nimbu now is also very different.
Ah, interesting.
You know, the make of the Nimbu, I don't know what we are eating and what we are applying now. So it's very different. Now,
Good point,
even
yeah.
when we say organic, I don't know how organic that is in most times, in most cases that is. Now, what we've now realized is there is more of irritation contact dermatitis with all these home remedies that people do than the result that they're looking for.
Oh.
So the only thing that when people ask me, I allow is dahi and kacha doodh, because that has lactic acid and that can actually benefit. But other than that, anything else, tomato, aloo, besan, haldi, whatever, I just said, just don't do that. Nimbu, anything.
So when you say curd and milk,
Curd
so
and
what to do with curd and milk? Put it on
You
your
can
skin?
apply on your skin, leave it for about 5 or 10 minutes and then wash it. Then
Oh,
wash
5
your
or 10
skin.
minutes?
Yeah. You wash your, because that's got lactic acid. That's going to lighten and hydrate your skin a little. It's going to help in increasing the cell turnover a little.
Right.
So these are safe things to do.
Ah, okay. Interesting. So you're saying don't go back to the putting lime on your skin, but curd and milk is okay.
Yeah, absolutely.
Right, okay. And again, the ideal is go to a dermatologist.
Ideal, yes.
Right?
Now we
Use
have
their-
such good products, and which I can get a product for my skin type and you can get a product for your skin type, which was not the scenario maybe 15 years back, maybe 20 years back, maybe 30 years back. But now we have those options. Why not do the right thing? Just do minimal, but do what is right.
Right, okay. The other thing which is very common is getting a facial done. Right? There's this thing called facial. Even when I go to get a haircut, the
salon guy would suggest.
They would normally say get a facial done. And like I honestly shared with you, I've never got anything done. I'm just very scared of these things. Is it okay to get these facials done, or it depends on where you get it done? And what is a facial?
So, facial is a pampering technique.
Oh.
Okay. It's just a procedure to pamper your skin. It's helping your skin to get its extra dead cell pileup to be done with, and then you hydrate your skin.
Okay.
That's essentially what a facial is meant to do. Now, what we used to see as dermatologists, inherently we were very, very against facials. Because a lot of times, wrong products are used for wrong skin types. Because facial is, when you go to a salon and you get a facial done, there is no customization of what is needed for my skin type. And with, due regard to all of them, the knowledge and the education does not permit them to understand and evaluate and analyze the skin properly. So the concept of medifacials came in. Because people will still want to do something to pamper their skin.
Right.
You may not have a skin disorder every time. You may just want to pamper your skin. So the concept of medifacials came in, where customization of the right products and steps are done for your skin type. Let that be done by your dermatologist, to be assessed by your dermatologist and executed appropriately. Because the products, the steps, all of that will be according to what's needed for you.
I guess what I'm getting from you is, one, use a dermatologist for almost any thing you want to do to your skin.
Absolutely. Treat it like one organ.
Treat it like one organ. And perhaps what historically we haven't done, especially in India, is treat skin as an organ.
Yes.
And go to a doctor.
Yes, absolutely.
When you want to do something about it, like the same that you do for your heart or your lungs or your kidneys
Correct.
or whatever.
Absolutely.
We almost treat skin as a beauty item, and we say, why worry so much? Skinny to hai, matlab, just put some cream and some lotion.
And we don't realize भगवान ने ये organ हमको एक visible organ इसलिए बनाया है because we can't see our internal organs. It's a reflector of my internal body status. It's going to reflect everything, physical, mental, external, everything that my body is taking. So respect the organ and let your doctor who's right for this organ deal with it.
Being a dermatologist, you are the expert. You know it all, right? So what do you do? Share with us
my skincare regimen.
Your skincare regimen. What do you do? Is it your sleep cycle? Is it what you eat? Are you very careful about what you eat? I mean, clearly, I'm sure you have great skin. And so what is your regimen?
Well, I'm humbled, and I'll take that as a compliment that I have good skin. So, and this is where I must tell everyone that for most part of my, so now I'm in mid-40s, for most part of my life till now, I didn't use a lot of products on my skin through my college and other years. So when I see a lot of young girls, that's why I get a little wary. Because the longer that you retain the innocence of your skin, the longer it will be on your side later.
Okay.
But using, and that's what I used to do earlier, just wash the face twice, use a moisturizer at bedtime, and use your sunscreen during the day. Now, this is something that, frankly, I did with a lot of discipline through my college years and later. Now, also, I still haven't got into the regimen where I've introduced retinol for my skin yet, and this is me speaking as a dermatologist, something that we see everyone using it so commonly now. So that's exactly what I'm trying to tell, that my skin, in spite of it being a very oily skin, I don't feel the need to use a lot of retinol on my skin. I hydrate my skin well. I've now introduced peptides, I've introduced vitamin C, I've introduced hyaluronic acid creams on my skin. I take a lot of medifacials regularly, I take a lot of skin boosters regularly, which helps my skin remain healthy naturally and hydrated. So I just do minimal, but I do it the right way.
Okay.
And I use a sunscreen during the day.
And I'm sure your husband, your kids have great skin and they've got a dermatologist
I hope
at
they're
home.
representing me well everywhere.
Yeah.
You know.
But sometimes ghar ki murgi dal barabar. So
all the time. So both my kids are in teen and preteen, and they have acne, and I have to tell them a lot of times, please get this treated, wash your face
boys
twice.
Or girls?
I have one boy, one girl.
Okay.
Wash your face properly. Please use the sunscreen. Thodi izzat ki baat hai. Just do that. Then kids will be kids, and I let them be also sometimes, because I like the innocence to be retained.
Of
so
course,
it's okay.
yeah. No, great. And the second question was about hair. Is hair loss and what happens to your hair growth also somehow connected to dermatology?
Absolutely.
Okay.
So skin is the organ, and it has appendages, hair being one of those appendages. And otherwise, not having hair is not bimari on its own. It's not a disease, but it's a reflector.
Oh.
So like if you have hair loss, you could have hair loss. We had hair loss post-COVID. We can have hair loss post-typhoid, post-dengue, post any surgery, pregnancy, any hormonal variation. In young men because of lifestyle disorders, early patterned hair loss.
Right.
So hair is also a part and reflector of your body status because it's a part of your skin.
So as a dermatologist, what is your advice for people with hair loss? Should you, the big thing that I hear about in that field today is hair transplant.
Correct.
And a lot of people I've heard are going to Turkey for it. So what is your opinion about all this? Is transplant the right thing? Is something else the right thing? Is Turkey the right place?
So transplant is, one, we need to understand younger the age of onset, faster will be the progression, and more resistant it will be to treatment. So when you realize that you have hair loss, you start acting on it early. And male pattern, the hair transplant element that we're discussing about is essentially the male pattern hair loss that we're talking about, which is testosterone based. From men, you cannot remove testosterone. I can't cause feminization of men. And since I'm not going to really remove testosterone, once you start with this hair loss, it's going to be progressive. I as a doctor can delay the speed, I can retard the speed of progression, I cannot undo it.
Okay.
So as long as I want hair, you want hair, you'll have to work and you'll have to continue getting this treated. Transplant, ideally, when I was studying, it depended on the grade of the hair loss that we were dealing with.
Okay.
Now, of course, internationally the guidelines have changed. If I don't like my hairline, I can go and get a transplant done. But I still suggest to everyone that before you get a transplant done, for about 6 months to a year, if the grade is not very severe, you don't have something which is important, impending social commitment that is coming up, then in that case, for at least 6 months to a year, get this treated. Use minoxidil, use your protein serums, use your vitamins properly, get the area to be prepared for a transplant appropriately and get that done. Now about Turkey, yes. Turkey, they've managed to promote themselves well, I must say. We were just discussing, we were a group of dermatologists on a training abroad recently, and we were discussing about this. They've managed to promote themselves very well. But frankly, our doctors, our hair transplant surgeons are very competent. And this is more of medical tourism that is happening, that you go to Turkey and you get your transplant done. Maybe it's relatively, there could be a cost difference also. But factually speaking, our hair transplant surgeons are very competent. So getting transplant done in India and where you're from is actually a better thing to do.
Okay. And there are good places in India to do it.
Of course, lots of good places now.
And again, perhaps the thing to be careful about is that they have the right dermatologist there.
The right dermatologist or the right plastic surgeon. You have either a dermatologist or a plastic surgeon doing the hair transplant, and you have to make sure that it's a doctor who's doing the transplant. A lot of times these technicians do the transplant. So just find out the repute of the doctor and the experience and the results of your doctor and get it done from a good doctor here.
Okay, okay. Great. Very useful information. And in the end, I want to know two things. One, what all of these issues or services do you take care of? And lastly, how can people reach out to you?
So I practice in Gurgaon. My clinic is called Citrine Clinic. We're in expansion mode also now. We're setting up more branches soon. As of now, I'm in Sector 15 in Gurgaon. I practice both clinical dermatology and cosmetic dermatology. So I've done my fellowships and trainings in cosmetic dermatology, and post my MD, I'd also done senior residency. So I have a lot of extensive experience for clinical dermatology, and I like to be a physician also, along with being an aesthetic physician. I like my clinical dermatology part. So we practice both. With cosmetic dermatology, you name it and we do it in our center. Except for plastic surgery options. We have all non-surgical intervention, whatever that you can name in terms of latest and something that has been established. Everything we practice and we do everything.
Okay, and how do people reach out to you?
So they can Google up for Citrine Clinic or Dr. Niti Gaur, and they'll have my website details and my clinic details over there, and they can reach out.
So there are contact numbers they can call and
absolutely
set up an appointment. Yeah. Great. Dr. Gaur, thank you so much.